Mental Health First Aid. I'm Denise Ellsbury, and today our guest is Dr. Nadjeh Awadallah. And Nadjeh was a guest with us before, so welcome back.
Thanks for having me.
Great. So you do a bunch of different things at Linden Oaks. You are a business development person for Northwest Community Healthcare, which is part of the Linden Oaks system for behavioral health.
Yep.
You also provide outpatient counseling through Linden Oaks Medical Group, correct? And what else? I don't know. You develop different programs. Anything else that I'm missing?
No, that's pretty much it. I do a lot of business development and community outreach in the northwest suburbs for Northwest Community Hospital. I see patients as a clinician in Linden Oaks Medical Group, and then I also do with program development up at Northwest Community Hospital as well. So in the last year, they've actually expanded their service lines pretty vastly. They had previously just had acute inpatient behavioral health for adults, and they had acute inpatient behavioral health for adolescents, and then partial hospitalization and intensive outpatient. Since we started working with them, we've added partial hospitalization for adults, intensive outpatient for adults, a CD or a chemical dependency residential for adults, and we've kind of expanded services, and we're continuing to expand. We're going to be continuing to build programming there. So I helped with a lot of the program development for those new service lines.
Great. Well, the reason I wanted to have you come back and chat with us again is that one of the other things, like you say, in terms of program development that you've worked on is actually some educational programming and curriculum type development as well over the last year. So when you were here before, we talked about the Rethink program. So I just wanted to revisit that a little bit, and then also talk about a new program that you've been working on in the last 6 months or so. But give us an update on Rethink again. Sort of let's refresh our memories.
Okay, sure.
That.
So the Rethink program is, is a program for use through schools for middle schools and high schools for students who are being punished for substance-related issues. So if they get suspended for drug-related issues, they would be able to go through the Rethink program. And what it is, it's a blended intervention where students would be referred to the program. They would be given access to an online independent learning module about substance use. The program's focused on cognitive behavioral therapy, and it also goes through like the addictions model and some different ways that people's thoughts impact their behaviors and how they make choices.
Because that's kind of what cognitive behavioral therapy is kind of making the connection between the thoughts that people have, the feelings that they have, and then the behaviors that they might do, kind of a
exactly.
thing.
And so the program relates that cycle to substance use.
Okay.
And so once a student completes the independent learning module, they also come to one of the locations where the class is being hosted. In our pilot phase, we hosted it at Northwest Community Hospital, and we also hosted it at Elmhurst Hospital. And they would come and they would attend an on-ground lecture with their parent that would be facilitated by a clinician that would go through the content of the workbook that they'd completed, and they would also go through some more information about the continuum of addiction. And then once they completed that, they would also complete an exit survey on their substance use behavior. And then that would act as a resource for the school to use as a means to reduce or not even give a suspension. So in our pilot phase, we had worked with 22 different schools. Over 72 students went through the program. We did get some really good feedback from schools and also from parents because they had appreciated the ability to start using the online component right away before they had to come to the scheduled on-ground class. And it's even more advantageous in the upcoming school year since State Senate Bill 100 was passed, which is
I was going to say, and what's that?
Yeah, so State Senate Bill 100 limits the number of hours a student is outside of school for punitive reasons. So no longer doing out-of-school suspension. This program is congruent with that because they can run an in-school suspension where the student is issued like a tablet or a computer for them to work on the online portion while they're being proctored in school.
So
And
they
so-
may not be like in their actual classroom, they might be in a separate room, but they still are in the building kind of a thing.
Right, and this is something that could be initiated right at the time that they're issued the punishment, and then they're scheduled to come in when we're hosting the next class with their parent.
So it was very timely that you had developed that program because of, what is it, Senate Bill
State Senate Bill 100.
100, which really makes a lot of sense. It doesn't serve much function for kids to be sitting at home, not really doing anything.
Right. Yeah, so a lot of the feedback we've gotten from schools who participated in the program like the ability to start working on things at school right away.
Sure.
And since the success of, or the response to it was positive in the pilot phase, we're actually expanding to the other Linden Oaks locations also.
So will it be at all of the different locations?
I believe
then?
that Naperville is going to serve St. Charles and Plainfield as well in the next year, and it'll be at Hinsdale.
Okay.
So we'll be continuing to expand the program and hone the program as we continue to work and collect data. So
Nice. So when students and their parents come in for the in-office session piece of it, is that like a one-on-one thing with the?
it's a class.
So there may be other students and parents there as well?
Yeah, so master's level clinician would, facilitate the class. They would talk about the concepts of CBT that the student would have worked on in the independent learning module before they came in. And they would also conduct a seminar-style discussion with the parents so they can ask questions.
And
about
are
what is it.
parents and students in the same group altogether?
They are in the same group altogether, yes.
So that parents can hear what kids are saying and parents can hear what kids are being taught, kind of a thing.
Yeah, and the parents might have questions, and this might be their first awareness that their student had anything like, or that their child had anything like this going on. So it's a good like neutral environment to discuss these sort of things as a family. So.
Is there an assessment portion of it in terms of looking at whether or not this particular child or student has more of a substance use problem, or is that not really built in? That's not the purpose of the program, per se.
If a student or a client or a patient, however you want to call them, looks like they have need for a further assessment, a full assessment, then they're referred for that. So of the 72 kids who came through the program, 20% of them were referred for a full assessment because of information that was collected either from the school collateral information or from the parent and the student when they arrived or over the phone or through the exit survey that they complete.
Okay.
So as a result of those things, students might show that there's a need for a higher level of care.
Sure.
And then we schedule them for the full 2-hour screening. And then once they complete the screening, we refer to them to the appropriate channel of care afterwards.
Okay. So some kids, it might be some experimentation use, bad decision about having it at school, and so this is really not necessarily a need for anything beyond the Rethink program, whereas there are some kids whose use has been maybe a little more ongoing, more extensive in things, and so that they're needing a little more service.
Yeah, this program is intended for kind of like the first-time offenders, and to be honest, a lot of the students who actually went through the program last year didn't even have any substance use, but they got ticketed because they were at a party or something that got broken up, and the school has to issue some punitive action for what they've done. So this is like the first step. This is a lower step than expulsion or suspension that the school can use in the meantime if they want to give them more opportunities.
Great. So when we come back, we're going to chat about the new de-escalation program. So join us after the break.
Mom, can we get some ice cream?
Please, Mom, please.
No, we're having dinner soon.
Please.
You don't have to be perfect to be a perfect parent. There are thousands of children in foster care who will take you just as you are.
Now, come on. All right, I know, 2 seconds. Hang on, just stand still. Stand still, love. 1 second, I know. He's done. Go, go, go. Boys, hang on, boys.
You don't have to be perfect to be a perfect parent. There are thousands of children in foster care who will take you just as you are.
Welcome back to Mental Health First Aid. We've been chatting with Dr. Nadjeh Awadallah about a number of different programs that he's instrumental in creating and making happen for Linden Oaks Behavioral Health and Northwest Community Hospital. So one of the new ones that I know you've been working on, because we've been working on it together, is a de-escalation class program for the general public. And so maybe let's just start out maybe talking about, you know, what is this whole deal about de-escalation, and why do you think it's such a problem or a need for people to understand?
I think it's important because when somebody notices a situation becoming emergent, them being able to step in and de-escalate the situation or intervene in the situation before it becomes maybe a more complicated problem to handle is really necessary. So for like the lay person who doesn't have any kind of a training in behavioral health or anything like that, that doesn't mean they're not going to encounter a situation where somebody is, you know, growing and they're becoming escalated, or they're becoming irrational as a result of stressors or something like that. Being able to assist them sometimes takes some finesse. You can't you can't just go in and tell somebody to calm down.
Calm down, right?
Because screaming "calm down" at someone should be effective, right? but some strategies to doing that to keep a situation from growing, and it's how much of an emergency it is really important, I think.
So what's going on for people that, like you say, there's sort of this, I don't know, overwhelming sense of reaction and loss of ability to make more rational decisions.
And everybody's triggered by different things. Everybody's triggered differently, but once a person recognizes that they're in a situation that's stressful, how they react to that stress might be different given environmental circumstances. If somebody's in like a busy place or some place where there's a lot of people, it might be more. It might be a heightened sense of stress for them, and people might not know how to react to that. So if you see somebody in a crowded place or in like an emergency department or something like that, at the mall or something like that, becoming frustrated with their situation, is stressed out, not knowing what to do, might lead to them just becoming visibly escalated, loud.
And like you say, sometimes people don't have effective responses to that. It's either I'm going to walk away from it, I'm going to yell at the person to calm down, and none of those are particularly helpful.
Yeah, because a bystander's instinct might be like, okay, we have to like restrain that person, control that person. But a lot of times when people are becoming escalated, it's because some perceived like loss of control. So somebody coming in and holding them down or doing something like that is only going to make the situation more alarming for them and only pull them into a further escalated state. So that's not helping the person. It's not helping to control the situation. It's not helping to make sure the situation stays safe for them and for all of the people around them.
Right.
So strategies to like de-escalate somebody verbally, to like establish a rapport with a person, establish that you're not there to be part of whatever is stressing them, whatever is triggering them, that you're there to assist them, can be reassuring, can be really helpful in quickly de-escalating somebody.
So I know as we've been working on developing this class, one of the things that kind of gets addressed is sort of that fight response that people have. What can you tell us about that?
Fight or flight is helpful in situations that are dangerous, right? But sometimes somebody gets triggered and they don't necessarily need to run away or fight someone, and then they still have all the physiological effects of fight or flight kicking into gear. So helping somebody recognize that it's not a dangerous situation for them, and helping them calm down, helping them self-regulate is really important, because it's not comfortable to feel in that state. It's not comfortable to feel like you have to run away or fight, or that you're experiencing some sort of danger. So helping them to recognize that the situation isn't dangerous, helping them to recognize that they have more control over what's going on with themselves is helpful.
So it's like you were saying, sort of that fight, flight response is a normal physiological process, right? Just something
Sure.
that happens, the process itself, without our being able to control it. But just like you were talking about cognitive behavioral therapy related to the Rethink program, it's a similar kind of thing, is people learning how to sort of have some awareness about that process, and then being able to make some decisions about what they're going to do about it.
A lot of times somebody will say after they experience something like that, it's like they couldn't control the situation, they couldn't control themselves. Like they think that they don't have a choice in the matter, but helping them to recognize that they have a choice in how they're perceiving what's going on, reacting to what's going on is one thing that the de-escalation program does. Those people, it reassures them that some of the strategies include like reassuring them that you recognize the thing that they identify as a stressor, and that you recognize why it's stressful for them, and that you want to help them in addressing whatever it is, so it's not creating a problem for them anymore.
Right.
Sometimes they throw their hands up and they don't know what to do, and so they act out emotionally. So this would.
One of the interesting things that really I learned as we were doing that, which I mean, it should be pretty aware, but it was kind of just an aha moment for me, was thinking about sort of in those situations, whether it's like I'm in a crowded place and I'm feeling like I'm running out of time to stand in this line or whatever, is that it's not so much about that right now, but that it's threatening some deeper need that I might have, right? Like, I'm not going to get everything done or whatever, and that people are often responding to some kind of deeper need that we don't have to talk about necessarily, but somehow that need needs to be addressed in some way.
Yeah, maybe they're thinking about like the snowball effect of problems that are going to result from the thing that's stressing them then. But helping them be mindful and in the moment is what's going to pull them to a more like rational vein of thinking.
Right. So we don't have to talk about that deeper need, but as the helping person, to be aware that it's more than just what's happening right now.
Yeah, the intervention is solutions focused. What do you
Yes.
need? What do you need to do right now in order to feel more comfortable?
Right.
And then deal with the other things, as you can, one at a time.
Right.
Because
right.
there's this sense of being overwhelmed. There's a lot of things going on at once. Helping people to slow down and just take, whatever the triggers are, one thing at a time. It
Right.
could be, really, really effective.
Right. It might be a deeper need of like, this situation isn't fair, or people aren't paying attention to me, or a lot of those things.
Yeah, a lot of people get really, upset, agitated like when there's lack of justice, or they're getting, people aren't respecting them or something like that. If you just boil it down to, okay, what needs to happen right now, instead of getting into this like why me idea, but what do I do next?
Sure.
Is more, getting them to think that way.
Right.
What do I need to do next to get, further, closer to whatever the solution is to this, rather than just being frustrated with the situation.
Right. And the fact that you, as the helping person, are maybe paying attention to them about injustice or whatever. So when we get back, let's maybe talk about some of the more specifics of the program, like, topics, time frame, audiences, all that kind of stuff, so people can know that that's available. So join us when we get back, and we'll hear about some of the specifics of this de-escalation program.
Now, come on. All right. I know. 2 seconds. Hang on. Just stand still. Stand still, love. 1 second. I know. Just I know. Okay, good. Okay, go, go, go. Boys, hang on, boys!
You don't have to be perfect to be a perfect parent. There are thousands of children in foster care who will take you just as you are.
Wow, these are really good. You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Welcome back to Mental Health First Aid. We've been talking about a de-escalation class that Linden Oaks Behavioral Health will soon be offering. So we kind of talked about some of the theory behind de-escalation and why that might be helpful for people to know how to assist people. But maybe let's talk about some of the specifics of the class itself. So what can you tell, like how long of a class would this be?
It'll be about a 2-hour class.
Okay. And what type of audiences?
Really, I mean, it's for non-clinicians. So really anybody who would be working or would be in a place where they might need to use de-escalation skills. I mean, you don't teach somebody first aid because you're like, just because of their job necessarily. They're just a good skill set to have. But I mean, this would be helpful for people who like work in schools, for example, or like think about people who might be somewhere where people become escalated. So like an EMS person, somebody who's going to be going on to an area where you know that there is an emergency and other people might need to be calmed down, other people might need to be stabilized, I guess, in the reaction to what's going on. So it's really for anybody.
Okay.
It's a good skill set to have. Like you wouldn't teach somebody CPR just because you think they're going to be, you know, working in like a place where somebody like a lifeguard isn't the only person who knows CPR, for example.
Right.
So anybody who would work with the public, this could be something that could be helpful for them too.
Right. Like I make that analogy with mental health first aid a lot, that really when we think about how frequently people experience mental health problems, or when you think about how frequently people become escalated, gosh, it could be a useful skill for just about anybody to at least have some more understanding about. And not only so that you can help other people, but I think sometimes when you go through classes like that, you tend to bring more self-awareness and manage your own kind of stress or situations a little bit better.
Yeah, so much of what the program teaches is what you introduce into a situation and how your body language, your facial expressions, your reactions contribute to whether or not the person you're trying to help becomes further escalated. And so going through the program also can help you to just have some more self-awareness. Like, what am I doing in this situation? How am I contributing to maybe the triggers in the situation, maybe unwittingly? Maybe somebody might be thinking that they're helping, but not recognizing that the thing that they're doing is just making the situation more difficult for that person. So one important component within the de-escalation class is like self-awareness.
Great.
Recognizing how to use active listening skills. Not to put somebody in a situation where they feel like you're part of the trigger, you're part of the problem.
Great. So 2-hour class, pretty much for general public or whoever would want to take it. And is it kind of a lecture format, or what would be?
Well, it's kind of a lecture format. It's more seminar style because we're looking for open discussion. We're looking for people to have, their own personal experiences to discuss, so we can look at and troubleshoot what it is that they've been experiencing in the past. There's like a animated video that's a component that shows some examples of what would happen in public settings when people get escalated, and what are some different approaches to what are some of the right things to do and what are some of the wrong things to do when you're approaching that situation. So is very much looking to have like group interaction as part of as a learning tool.
Great. Yeah, I always say I think one of the things I really appreciate about mental health first aid as a class is that even though it's an 8-hour class, there's so many different activities that are involved in the course that it really does facilitate people's learning, and people are actively engaged in that process instead of just being receptors of information that's thrown at them. And so I know that the de-escalation course is similar in design in that there is discussion, there are activities. There is this video that people can watch and use for discussion purposes, as well as then some scenarios that people are going to sort of talk through about how they might handle those situations.
Sure, because we don't just lecture the concepts, we have them practice the skills in class, and then there's role play that's used to try to practice those skills, as a group. And so it's a real interactive style of learning.
I think one of the things that's always helpful for people is to be able to actually hear statements and get feedback on, was that a helpful way to phrase that or state that, or maybe not as helpful as I thought it was, kind of thing.
Right, and then getting feedback from other people in the class and how you handle things is really helpful, because we might not know what we look like when we're observing, an emergent situation or an escalating situation. The nonverbal that we're introducing into it, if we're acting in a way that seems judgmental or acting in a way that seems like we're evaluating, the worth of what's going on. Like, did this person have a right to be upset? It's not something that we should be deciding for them. It's just a matter of helping them calm down.
Right.
So.
Right. So an active learning process throughout this class. And one of the skills that you have that we really haven't talked about is that animation piece. So I know you've worked on an animation piece for that class, as well as the Rethink class that we were talking about earlier.
Right. So for the online learning module for Rethink, as a component of that, there's a 35-minute cartoon really that the kids use that shows examples of the skills they're going to be learning in the workbook, and really good feedback from that. Kids, students like the accessibility of it.
Sure.
There's some elements of humor in it, and so it had some really good positive feedback. Schools really liked it, so no need to reinvent the wheel. Went with the same route for the videos used for the de-escalation program.
So and that was something that you've designed and created. So since you're an office mate of mine, we always appreciate your drawing ability for things.
So finally got to use it for something useful.
So let's see. When do we expect that the de-escalation program, do you think, might be available? Probably like November of 2016?
We're looking in the next couple of months to have that completely vetted and finalized. So we're hoping for November of this year that we'll start being able to give classes to the public.
Great. And that people probably be able to access that by just going online to the Linden Oaks website and being able to find that. Great. Would it be like a team taught kind of thing? Probably 2 instructors for that class?
Yeah, I think that's our goal. Our goal is to have like a 2-person instructed class to help facilitate group discussion. It's also helpful for people to work with each other to give the examples and things like that. So that's our goal in staffing and having it facilitated.
Great. And people will have some takeaways in terms of handouts, directions, opportunities to kind of make notes of some of the useful topics or statements to make. Or
right.
Things
We're hoping that people further develop skills that they already have or learn new skills when they come in, and how to be a cooperative person, how to be a helpful person in an emergent situation.
Great. Well, Nadjeh, I appreciate you coming back to be a guest with us again to kind of revisit Rethink and hear about how that's been going, and also to talk about this new de-escalation class that we'll be offering through Linden Oaks Behavioral Health. So thanks for joining us, and in the meantime, be well.